Thank you, Mr. Chairman, and joining me this evening is Congressman Altmaier from Pennsylvania. I think it's only fitting that on this Valentine's Day we begin to have a discussion about health care in America. It's a heartwarming day, it's a day of friendship, a day of conversation between one's loved ones. And when I was sent here by the people of Northeast Wisconsin, I was sent here to listen to their concerns. In my previous existence, I was a physician caring for many thousands of people across Northeast Wisconsin. And I've continued to listen to them while I'm here in the halls of Congress, and I want to share in the first few minutes of this hour some of their conversations with me. Tom and Sue write from New London. When I asked them what was important to them, 50 million people without health insurance is a disgrace. Tom and Sue are right, but they're not alone. Bob from Green Bay writes, if taxpayers can't get the same health insurance as Congress, at least get drug costs down so we can afford our pills. What about from Casco? Russ writes, I'm 60 years old and I've got $500 deductible on my health. $500 deductible on everybody. Actually, it's $5,000. Another zero. $5,000 deductible on my health insurance per family member. All of our health expenses out of pocket. We need help desperately. That's Russ in Casco. In Greenville, it's the same story. This is from Al and Linda. As we near retirement, we know we can't afford health insurance premiums or drugs on our own. Please help. We're getting towards retirement. We don't have the money. From De Pere, it's Kathleen. It's time for all Americans to have the same health care benefits as their representatives in Washington. And finally, from Crivets, Al writes, without a job that pays a fair wage, I won't have money to pay for health care, gas, a war, Social Security, or anything else. My friends, my colleagues, it's time for us to have an open and honest discussion about what's important in America. And if it's not your health, I don't know what it is. Because if you don't have your health, you don't have anything. I yield to my colleague from Pennsylvania, Mr. Altmaier.
And I want to commend Dr. Kagan for his leadership on this issue. And as all of our colleagues know, Dr. Kagan, right from the very start, has made health care his top priority here in Congress using his expertise. I have a health care background as well. Health care policy is my professional background, and the gentleman and I have spoken numerous times about the importance of health care, and I wanted to status, which would lower the costs for almost everybody. So at this point, I am going to thank the gentleman for allowing me to say a few words and commend Dr. Kagan for his work. I yield back.
And I appreciate you being here tonight, Mr. Altmaier. Your contributions to Congress have already been exemplary, and I look forward to working with you in the future on health care issues. And it's not just you and I, it's not just the members of the class of 2006, a group I call America's Hope for a real change and a positive change in the direction of our country. It's not just the people that call us up, not just the people that send us postcards, not just my patients back home, but it's the most trusted person in Washington, D.C., that understands the importance of health care costs today. And who is that person? That's our Comptroller General, David Walker, who on January 28th, before the Senate Budget Committee, had these words to say, and I quote, under any plausible scenario, the federal budget is on an imprudent and unsustainable path. Rapidly rising health care costs are not simply a federal budget problem, they are our nation's #1 fiscal challenge. The growth in health-related spending is the primary driver of the fiscal challenges facing the state and local governments. Unsustainable growth in health care spending is a system-wide challenge that also threatens to erode the ability of employers to provide coverage for their workers and undercuts our ability to compete in a global marketplace. And he went on to say that the key points in his presentation are, quote, although recent declines in our annual budget deficit are good news, our longer-term fiscal outlook is worse. And absent meaningful action, we will face spiraling levels of debt. Our long-term fiscal challenge is primarily a health care challenge. And I close quotes. Well, I think the Comptroller General has it right. It's our health care challenge. And people every day in Wisconsin and across the country are challenged when they receive in the mail a solicitation from an insurance company, one such as this. And with happy, smiling faces on the front, they invite you to call an 800 number to see if you qualify. But here's the list, and it reads, important information about pre-existing conditions. Although we make every effort to extend coverage to all applicants, not everyone will qualify. If you've had treatment for any of the following conditions, you may not qualify for coverage. And it lists a long list of conditions that many millions of people have. And at the very end, there's a real teaser. And it says, quote, this list is not all-inclusive. Other conditions may apply. My friends and my fellow Americans, I believe it's time on this Valentine's Day, February 14th of 2008, to bring an end to the discriminatory actions that insurance companies now enjoy. We have to bring an end to the discrimination against any citizen in this country based on their pre-existing medical conditions. And before I highlight the bill that I'm putting in for submission today, it's called the No Discrimination in Health Insurance Act, I'd like to review with you what we have today in our health care system. And it's here to my right. Our health care system is simply unsustainable. There are 3 tiers to health care. In Tier 1, in red and orange, we have Medicaid, which is 61 million Americans, and Medicare, 43 million. These people, in general, don't pay for the bill. They don't feel the economic cost because government is providing for their needs in most cases. So in Tier 1, you have a group of people that aren't paying the bill. In Tier 2, you will pay a portion of your bill. And this has to do with the 149 million Americans that have health insurance. But increasingly today, the health insurance premium is skyrocketing. And the cost for care averages $14,000 each year for a household of 4. This price and this cost is beyond what the normal hardworking family in Wisconsin and elsewhere in the country can afford to pay. In Tier 3, this is the 47 million American citizens who have no health care coverage at all. And I'm one of them, as the only member of Congress who has not signed on for health care benefits. For I didn't come here for a benefit. I came here to guarantee access to affordable care for everyone. 47 million Americans who choose not to purchase insurance either because they don't have the money in their pocket or they can't afford it. So our system as it exists today is unsustainable, unbalanced, and is tipping over rapidly. That is why I submitted for passage a bill called the No Discrimination in Health Insurance Act.